what does a typical day look like for you as a promotional medical writer? Because I think this will help us understand or help us envision you kind of in that environment before we get into some of the specifics. So what do you have a typical day?
So let me answer this question in a slightly different way. I'll describe to you a typical project as opposed to a typical day, because there is no such thing as a typical day. And every day is different because we get different requests. Sometimes we get a request to create something for social media. Sometimes we have a request to create a website. Sometimes the request is to create two different websites. One is, for the same product. One could be patient facing, and then a second website could be healthcare provider facing. And so there are different requests coming in from different clients who want to promote their products to different types of audiences. But at the crux of all this is the writing aspect. And in order to write something, especially in the promotional medical writing field or in the advertising field, the core aspect of what we write is called a claim, essentially a series of claims. So to put that in perspective, if you are, let's say, a scientific writer who does publications, then the core aspect of your work is to create that manuscript. If you are a CME writer, then the core aspect of that work might be to create a slide deck, which could be providing just enough information to provide 1 or 2 credits worth of information to a healthcare provider audience. So using that as an analogy, the core aspect of being a promotional medical writer or a medical writer in the advertising space is to create core claims. Now, what are these core claims? A claim is anything that can be said legally about a certain product without violating any rules of that product and without infringing on any of the competitor products, right? So the way it begins is we delve into the medical literature. We delve into the trial literature because we only worked with approved products. And we come up with a series of statements that have to do with the efficacy of a certain product or a device and the safety of a certain product or device and who it's going to benefit. And what is the best use, what is the best case scenario, who is the target audience for that device or that product. Once we have this information, we create a series of draft claims. And then we go through the process of presenting those draft claims to 3 different types of audiences. And this is where the MLR review comes in. M stands for medical, L stands for legal, and R stands for regulatory. So the first round is the medical review, where people with a medical background look at those draft claims and provide their feedback. The second is a legal review, where people from a legal background will look at those claims and determine whether they accurately mention the core features of a product or a device, and at the same time don't infringe on any of the competitor products or devices. And then you have the R, which is the regulatory review, where people with a regulatory background come in and say, can these claims be made without violating any of the regulatory rules, and do they fit within the regulatory framework established by the FDA if we're creating these claims in the US, or the EU if you're creating these claims for any drugs marketed within the European Union. And so we go from these draft claims through this process to a series of core claims. And those core claims then become usable in different types of avenues, whether you'd want to create something for social media, or you want to create something for a website, or you'd like to create something for a brochure given to a patient or a leave behind in a doctor's office. It all comes from those series of core claims. So essentially, from a writer's perspective, those core claims have to be strategically well thought out, scientifically researched, and legally valid and clean from a regulatory perspective. So I would say that is the core aspect of what we do, and that is what a core project would look like.
Oh, that's so interesting. Just to share my perspective. So I was only in advertising for a few weeks, and I actually really enjoyed the work, and I would have stayed, but the commute was really long for me at the time. It was all in-house and I was exhausted, and it just sucked the life out of me. Now everything is remote, I believe, or a lot of people are still working remotely. So I feel like if the timing had been better, I would have stayed. But in the small amount of time that I was there, I was like on the creative side. So maybe we can talk about kind of like different types of writing. in an agency. So I was on the creative side where the claims would already be there. Like we'd know what the approved claims were, we'd have access to them, but then we'd have like a banner or a website or some sort of ad that we would have to write copy for. And then I would be figuring out, okay, how do we say what we need to say without so in Canada, you can't really make any claims at all. It's quite different to how it is in the US, which is another thing I think we should discuss, because I was so restricted with what I was allowed to say, and there was hardly anything I was allowed to say. So it was creative in the sense that, like, well, how do you say what you want to say without saying anything? But that was part of the fun of it. So I guess yeah, are there different types? Because there were medical writers in a different section of the agency that I was at, and I was on the creative side. So can you speak to that a bit more so people can try to put pieces together?
Sure. So broadly, I would say there are two different aspects of promotional medical writing. So to echo what you just said, the work that you were doing more closely aligns with writing creative copy, where you take existing claims and you find ways of creatively positioning them within different types of deliverables in order to create the most impact. So for instance, you could look at a claim and say this would fit really well in a brochure that goes out to a patient because it gives them information about quality of life. It gives them information about how their life could improve without getting too much into the nitty-gritties of the efficacy components. On the other hand, you might look at a different claim and says this would look really good in a reprint carrier or in a leave behind that stays in a doctor's office because it speaks to the technical aspects of how a drug or a device is superior compared to the competition. And it's something which really plays into the information that a doctor already has. Because when you present something very simple or simplistic to a doctor, it's kind of talking down to them. It comes across as patronizing. So you would select information which takes into consideration the training and the rigor that a doctor would be used to, and you're presenting information which speaks at that level. So the creative copy team is really involved, echoing once again what you said, the creative copy team would be involved in making those types of decisions, picking from the pool of approved claims and creating these avenues where they can put these different claims in different types of documents. The other type of writing is, I would say, one step upstream, which is to go from a world where there are no claims to then doing the research to come up with the claims themselves. And that's the kind of writing that I was involved in, which involves a little bit more of digging around, investigative work, scientific research, putting on your Sherlock Holmes hat to determine what pieces of evidence to include and how it comes together as a story.